Welcome, everyone. We're happy that you can join us today for this fourth session of the Campus COVID Q&A webinar series. My name is Sue Ng. I'm the Deputy Director in the Office of Administration and Finance, and I will be your moderator. This is a safe space for you to ask questions about COVID vaccinations, boosters, masks, safety measures, and other COVID-related items in place at Hostos Community College. This session is being recorded. Closed captioning is available. You may submit your questions in the Q&A box, or if you're attending by phone, you may raise your hand and I will call upon you to ask your question. Today, your panelists are Fabian Wander, Director of the Health and Wellness Center, and Zack Korenstein, Environmental Health and Safety Consultant, with special guest, Christine Dias-Singh, Executive Director of Human Resources. We'll start off by having each person briefly explain their role at Hostos, and then we'll commence with questions. Fabian, would you like to start?
Sure. Thank you, Sue, and good afternoon, everyone. My name again is Fabian Wander, Director of Health and Wellness Services. And my role with respect to COVID is COVID compliance with students on campus. So that's from when they, enroll into the college, and as they are enrolled in the college, we manage all the CUNY COVID compliance. Also under health services, our nurse follows up with any positive cases on campus, and we have a team working with contact tracing alongside Human Resources Department.
Hi, everybody. Welcome. Again, my name is Zack Korenstein. I am the Environmental Health and Safety Officer for Hostos Community College. And so environmental health and safety encompasses a lot of different areas, but specifically to COVID, I've been involved with the mask mandate and mask policies, as well as other infrastructure issues and overall approach to mitigation and prevention of potential spread and transmission of COVID, and working very closely with the administration on what was the reopening plan, and also making sure that as we come back to campus, we do so as safely as possible.
Thank you. Christine?
Thank you, and good afternoon. My name is Christine. I'm the Executive Director of HR, and I work very closely with this crew, with Mr. Korenstein and Mr. Wander, and also Nurse Vasquez, and also Chief Bernardi in coordinating all the COVID efforts. HR handles the cleared for, the testing, the vaccination, the return to work. I work closely with the nurse and provide guidance in terms of the quarantines, the clearances, the contact tracing, and anything else that comes up. We work in very close coordination.
Thank you, everyone. I guess we can start off this session with a couple of questions that we received through the COVID-19 at hostos.cuny.edu email. The first one, I think we'll start off with a student one. A student sent in a question asking, do we need the booster shot?
Yes, all students are required to have their booster shot. If you receive the Moderna or the Pfizer vaccine, then you have 5 months after that shot to get the booster. Well, actually, you're not allowed to get the shot until 5 months pass. So, for example, if you received your second shot of Moderna or Pfizer in January, then you would be eligible for your second shot 5 months after, which would be June. And you have 30 days from there to upload that vaccine onto CUNY first. If you have your Johnson & Johnson vaccine, then you would be required to get your booster 2 months after that shot. Question from last week was, will I get dropped from my classes this semester? The answer is no, you will not be dropped. However, when you register for the summer or fall session, you will not be allowed to register until you have that booster shot if you're eligible. And we all want students to register for the summer and the fall as early as possible. So if you are eligible, we encourage all students to get their shot for their own health and safety as well.
you, Fabian. We have a second question that asks for more information about the inspection and maintenance of the HVAC filters.
Right. So in terms of filters, I think it's important to remember that this is really one aspect of the overall HVAC systems, because all of our buildings have slight variations when it comes to the HVAC, heating, ventilation, and air conditioning systems on campus. So as I had said in previous sessions, all filters are changed out at least quarterly, sometimes earlier, and they go by manufacturer's specifications. Something to focus in, I think, even more on is the fact that we have filtration to take those physical particulates from the air as it's brought into the building. But again, all air passes through UVC, ultraviolet light on the C spectrum. This is a disinfecting process that actually kills SARS-CoV-2. And so again, that's a key piece to remember, because that is much better than certainly the majority of other community campuses. To have inline UVC in our HVAC systems is somewhat unique within the CUNY system. And again, that disinfecting measure has been used for many, many years within the hospital system for individuals that are in actually immune compromised situations and others that actually have respiratory illnesses, so that that UVC does not get transported to other parts of the hospital or even outside of the hospital. That's what we have here in our buildings. And again, that gives us a much higher level of overall air quality, especially when it comes to SARS-CoV-2, which is the disease that causes COVID-19.
Thank you, Zach. Those were the questions that came in through our inbox. If anyone has a question now, please feel free to drop it in the Q&A box. That there is a Q&A box and not the chat box. I just wanted to let people know. So if you do have one, please let us know. We do have a question, and I believe, Zach, you can stay on. An attendee asks, are all campus buildings now OSHA compliant for 195.88B13 potable water? What about floors of buildings? If you can, please answer to that.
Good question. So actually, I was just going to update everyone on just to get through the specifics of OSHA regulation. That's about potable water and drinking fountains. And so in the past, we did actually turn off drinking fountains as an extra precaution to keep folks masked as tightly as possible earlier in the pandemic. But at this point, I am working with facilities. All drinking fountains are being turned back on, are being flushed, and should be ready for use. Not all of them today, but they are in process for all drinking fountains to be turned back on, and everyone can use them freely at this point. Again, just check. If it's not working, the next day, hopefully it should be on, operational, and open for everyone's use.
Thank you, Zach. We actually have another question. It's a follow-up to a question from last week regarding electrostatic spraying. They actually have 3 follow-up questions. The first one being, are only electrostatic sprayers being used to fog, or are there traditional misters and foggers also being used? And if you want to start with that one, and I can follow up, after your response to that one with the next 2.
Right, actually, I did read ahead on that one, Sue. So yes, and I did want to follow up on that particular item as well. I know that a lot of people have seen the fogging operation and they see a Clorox bottle. I actually did follow up with the custodial staff and team, and actually we've moved away 100% from using the Clorox product. as I was kind of sharing with everyone last week, we are now solely using the hypochlorous acid solution that we're able to generate here on campus. And I think it's a little confusing because what's happening is that we're actually using, or the custodial team is using the old Clorox bottles because it's much easier to actually use that with the fogging systems that we have. And so actually it's an empty Clorox bottle that's being used and filled up with the hypochlorous solution that's being generated on site. Again, this is simply water, salt, and electricity. And again, that solution is being filled up with the Clorox bottles because it kind of fits into the system nicely. So when you see them moving around with the Clorox bottles, it's not actually a Clorox product. It is the hypochlorous acid that's being produced here on site. And hence, because of that, and again, I think good call for the anonymous attendee here, they are not really required to wear the level of PPE that was suggested for the Clorox product, because again, we've moved away from that completely. We do not use that. And so again, all the custodial staff do have that level of PPE. They have plenty of PPE, but a lot of folks are making some decisions and of course are encouraged to use the best personal protective equipment that we do have. But again, in the case of using the fogging system, it is solely the hypochlorous acid solution. We no longer use the Clorox product for varying reasons, health and safety being one of them.
Thank you, Zach. We have another question. Let's see. The attendee asks, please remind us what the recommended protocol is for faculty if we test positive or are sick and are teaching in person. Similarly, if a student tests positive in an in-person class, what guidance should faculty follow?
Go ahead, Christine, and I'll follow up with the student if you want.
Sure. Hi, Emmy. So the protocol is the same for anyone who tests positive or is experiencing symptoms. They immediately reach out to Nurse Vasquez and she will provide guidance, whether it's a student, faculty member, or staff.
Thank you, Christine. And just to ask for more, there isn't a the protocol changes based on the situation. So Nurse Vasquez or one of our contact tracers follows up right away and asks very specific questions to get information. So each case is a little bit different. So there isn't a specific protocol, but the really depends on the situation in the case. And then those protocols and the guidance is given to whether it be the faculty, staff, or students, or all three, by our nurse or one of our contact tracers.
Great, thank you both. As of now, we don't have any new questions, but I know that there's an announcement Christine would like to make while you're here about the VaxFan.
Thank you. Yes, we have a VaxFan on Tuesdays and Wednesdays from 9 a.m. to 6 p.m. and it's right in front of, it's in between the B and the C buildings, right on Grand Concourse. And you could just walk up with your CUNY ID and they give vaccines and they actually do the testing, but you can do the testing on site as well.
Thank you, Christine. I believe they're also setting up a table in the C building to provide some health information for the community also, I believe.
Yes, we're in the works right now planning. The New York State Department of Health will be coming on campus, providing some information and also information about health insurance enrollment as I think the new cycle begins soon. So they'll be providing information in that area as well. Hopefully sometime in March, they'll be on campus.
Thank you. If there are any other questions, please feel free to drop them in the Q&A box. Since we do not have any currently, if there are any other announcements that our panelists would like to, announce to our guests here, please feel free.
Yeah, since we have no other questions, again, I want, our attendees to really direct, how we go with this. But since we have nothing at the moment, let me talk a little bit about masks and mask mandates. So, I think first off, I want to remind everyone that we have a mask mandate at CUNY and at Hostos. I just checked in the other day with CUNY Central, Environmental Health and Safety Central, and asked them if there was any movement on any relaxing of mask mandates. That is not the case. We still will have a firm mask mandate here at Hostos and at CUNY for the foreseeable future. My hope is at least till the end of the semester, if not further in time. Now, here at CUNY, we are a quasi-city, quasi-state university system. I think that a lot of folks have gotten confused with some of the changes in mask mandates that Governor Hochul has done. Some folks live in New Jersey. Governor Murphy in New Jersey has relaxed the mask mandate even further out. As I've said before, I think it's important to remember the specific location that we are today. We're in the Bronx. This is New York City. This is the densest city in the United States. And so Eric Adams has not been as relaxed as Governor Hochul has been in terms of her changes to the mask mandate statewide. But again, let's remember, this is New York City. This is in Rochester. This is in way upstate New York in the Finger Lakes area, okay? We are much more packed in, much more densely populated. And so my professional opinion is that we do need to keep wearing masks for the time being, okay? Now, again, I am very cautiously optimistic that we are in a much better place than we were certainly even a couple of months ago during the heightened surge of Omicron. If anyone's seen lately, our case counts have dropped precipitously. I think citywide we're about 60 or so cases per 100,000. In the Bronx, we're about 40 cases per 100,000. So the case counts have really, really dropped. We are at a safer point in time now than maybe at any time in the pandemic. Again, that is not a reason to take off the mask. We cannot really do much for you when you're not here at Hostos, but when you are on our campus, you must wear a mask, some form of mask over your face and nose. This really is an incredibly important and effective tool in mitigating risk and reducing the likelihood of transmission of SARS-CoV-2 and other respiratory diseases. And so, I think a lot of people are starting to make their own decisions about masks. I know there's a lot of folks in the community and in America in general that aren't very, how should I put it? They aren't fans of masks, let's say. Again, whatever you believe about masks, they are very effective. They're not a burden. They don't take away your rights. And again, if you don't want to wear the best type of mask, by all means, you don't have to. But you do need to wear some level of masks at all times when you are on campus. I want to repeat and encourage everyone that wants a better mask, like a KN95. We have KN95s available for everyone, students, staff, faculty. All you need to do is walk up to a public safety station in one of our lobbies and ask for a mask. They will give you a KN95 or a surgical mask if you prefer. I would have to say, actually, at the moment, we are not getting the demand that I thought we would get. I think part of that is due to the fact that Omicron has really petered out at this point. But again, I will tell you what I'm doing. It's not time to take the mask off yet. Let's keep it on, okay? So again, at the same time, while we're in our buildings, let's remember, people need to drink, right? We're talking about drinking fountains and the importance of people being able to have access to potable water. People need to eat, okay? So I don't want anyone to have intense feelings of fear or anxiety when you see an individual eating or drinking. Again, if you're overly concerned, you can keep your mask on, you can eat separately from others. By all means, you can eat together as a group at this point. Again, we are at a safer point in this pandemic and this adventure of COVID together. And I want to remind folks also, the cafeteria is now open, okay, 7 days a week, 9 a.m. to 6 p.m. I saw students eating lunch today. I continue to see increased activity and life on campus. All of us have to continue to move forward with this. And again, I'm going to keep my mask on. I encourage you to do the same. Please go get a KN95. Get a better mask. Mask up in situations when you're in crowded environments, okay? Because this is New York City and we're going to be in crowded environments, but we have to keep moving forward with full vaccination, with continued mask use. We can begin to do more of what we used to. And I'm not going to tell you where I'm going, but I'm going on vacation next week with my family, my little baby, 7 months old. It's time to get out of the apartment. It's time for us to go someplace warm. Again, we're going to be very careful and vigilant. We'll continue to wear masks, except for the baby. But I encourage you to step out, wear a mask, look at the facts, and come back to life here at Hostos. Again, it's fantastic to see people here and students in class and engaging. And I think we're getting there. I hope that we are getting there.
Thank you so much, Zach. We have a question in the Q&A box. An attendee asks, is there any more clarity about the vaccine mandate the chancellor announced on February 14th with an April 1st deadline? One big unknown is whether at least some college assistants will be covered by this mandate.
I can answer that. And Zach, thank you so much. That was really wonderful what you said. And I echo that it is so nice to see the increased activity and to start to connect with our colleagues on campus. It really is a nice feeling, and just to see the vibrancy come back again. So yes, as you know, the chancellor sent out communications that vaccination is required, but he was very specific in terms of the vaccination requirement being specific to PSC members. So as you know, the governor had initially required that all faculty members be required to vaccinate, and the chancellor extended that to faculty and staff. However, at this point, in terms of answering the question about the college assistants, at this point, classified staff, which would include college assistants, COAs, CAAs, public safety, these type of titles that are classified staff are not currently required, but the PSC titles such as HEOs, faculty, CLTs, even part-time NTAs and part-time CLTs, these will be required to vaccinate by April 1st. And I'm sure that you've heard many times by Mr. Korenstein that we highly recommend that everybody vaccinates and boosts up. And that's why we want to make it as easy and convenient as possible by giving you the opportunity to easily go to the Vax van here, after work, before work. So yeah, and that requirement is going to, you're going to have your vaccination done by April 1st. So if you're doing the 2 shots as you know, the two shots are spread out. I believe it's at minimum 3 weeks apart. So we would encourage those that aren't vaccinated as of yet to go ahead and start that right now. And for the J&J shot, it's only a 1 shot, so you have a little more time. But if you do the Moderna or the Pfizer, you're going to have to allow time to get both of those shots. And then I just wanted to add that everything that Mr. Korenstein was saying, one of the best ways to protect ourselves, even with the declining numbers and, us being in a lot better place than we were in 2020, that to start to do more things, to go out, maybe vacation with our family, but using reasonable precautions, such as using masks, such as getting vaccinated, getting boosted, using reasonable precautions, and not getting together in large gatherings when we're unmasked. So all of these things are common sense approaches to continuing to lead our lives, reconnect with friends, family, and colleagues in a way that keeps us safe and healthy.
Thank you very much, Christine. We do not have any additional questions in our Q&A box, so I just want to put out a friendly reminder that if you have a question, to please enter it into the Q&A box. And Christine, if you have any other additional information or announcements, please feel free to take this time to do so. Or any of our panelists at that.
And also, just to add, as you vaccinate, that you can upload your vaccination in CUNY first. We've sent out reminders about that. We will continue to send out reminders. And if you have any questions, either in terms of uploading your vaccination or anything about restrictions or your cleared for access not working, you can reach out to HR. Denise Gomez Ramos, who's one of the HR associate directors, will be able to help you out.
Thank you, Christine. We have another question in the Q&A box. The attendee asks, sometimes my classroom feels like there's low airflow. Does this mean I'm not getting enough new air in my classroom? Who can I ask to check this out?
Right. So just because you may not feel a flow of air does not mean that air is not being supplied to the room. There is variation so that we can meet the set point. The set point is the temperature. And so it is a bit nuanced to ensure that we try to meet the set temperature, which is usually between 68 and 72 degrees. Once that temperature is met, there will be a reduction of airflow, but supply air is always being pumped into the classroom. Obviously, if you have a few more students and individuals in the classroom, naturally the temperature is going to go up to some degree. And again, that will also slow the airflow in. If you feel there's something wrong with a particular room, that can be checked out. You can reach out to me or to facilities, but by all means, folks can actually reach out, and that can be checked by facilities to ensure that the system is still running as it's supposed to and proper functionality.
Thank you, Zach. We have another question. The attendee asks, how long after you receive the booster can you upload it on CUNY first?
So right away, I would highly encourage you to upload it right away so you don't forget and just get it out of your system. I think when the system allowed me to upload my booster, it was a very simple process. I went on to CUNY first. vaccination verification link and just kind of did the same thing I did for the first 2 shots. It was a very simple process, and I highly encourage you to do it as soon as you have that booster shot. You can do it the same day.
I'm just going to add to that, if you don't mind. I think the question comes because when you do the 2 shots, it would only allow you to upload it 2 weeks after your second shot. And so it may be you can do it right away, but with the first 2 shots, you have to wait 2 weeks post because you're not considered fully vaccinated until 2 weeks out from the second shot. So we don't want to allow you access to the campus until you're considered fully vaccinated. And if you're not fully vaccinated, then you would be in the test pool and would be required to, have a negative test within 7 days of entry.
Yeah, and I just wanted to also mention, and I'm really happy to share that, I review the booster uploads every day, and I'm seeing a lot of students uploading boosters. And I feel like, a lot of that has to do with the CUNY, mandate encouraging students to have their vaccinations and their boosters, because I am seeing a lot of students kind of recently submitting their booster shots. So it's really encouraging that we are, protecting ourselves and we are protecting our community.
Thank you, Fabian and Christine. Again, to all of our attendees, please feel free to drop your questions into the Q&A box. Well, while we wait for more questions to come in, I just wanted to announce that, besides the cafeteria being open at this point for people to sit, eat, study or socialize, we also have new furniture in the C building on the 4th and 5th floors overlooking the atrium. So those are other areas where students, staff, and faculty can, take a seat, have either lunch or snack or study, socialize. So I just wanted to let people know there are additional spaces where, you can now enjoy the campus. And we have another question in. The attendee asks, what determines if a room is provided an additional HEPA filter? Can I request one?
So, I might call in Christine for this as well, actually. So there are a number of factors, but as I've said on this call, on this webinar before, there is no reason to have an independent HEPA filter in any space on campus at all, because again, our HVAC systems are optimal, they're excellent, they're better than the majority of other CUNY campuses, and they're providing excellently filtered and disinfected air. Most times when a HEPA filter is put into a room, it is somewhat related to an accommodation request, which is why I'm going to tap Christine into this. And so oftentimes, Christine and I would be in consultation together to discuss the request for a HEPA filter. Again, there is, from my technical perspective, there's really little to no technical reasoning to have a HEPA filter within our spaces.
Yeah, thank you, Zach. I think what you said basically clarifies, because we have a superior HVAC system. The air quality is already superior. And I think you described it as better than most New York City buildings and even some hospitals in terms of, the filtration, the 100% outside air, the UV light disinfection. So to add an extra filter not only is unnecessary, it's just, it doesn't really do anything given the setting that we're already in. Maybe different in another setting that doesn't have an HVAC system, such as ours, may be more appropriate in your home or in an elementary school that doesn't have an HVAC system. But in this setting, it's not really applicable.
I would add to that colleagues of mine at other CUNY campuses, maybe I'll leave the name off of this, but they utilize HEPA filters a little bit more. And oftentimes in some of their older buildings, the only ventilation mitigating factor is to open a window. And so in cases like that, maybe it would be more appropriate. But again, because we have a modern, sophisticated HVAC system, it is not really necessary.
Thank you, Zach and Christine. And thank you to the attendees for your questions. Again, if you have any, please drop them in the Q&A box. This webinar session is for our attendees. Like, if you have questions, please feel free to ask them. This is a safe space for you to ask these questions. And we'll answer them as best as we can. And if we are not able to at the time, we can get back to you certainly via email. Also, if you would like, please do feel free to send your questions to the COVID-19 at hostos.cuny.edu email address. We can always send you responses through that portal.
I would just say, so Alfonso, I hear you. I think we're all getting tired of the mask, but it is a good extra safety measure. The good thing is now hopefully soon, it's going to start to get warmer. And I would encourage all faculty and staff and students, in between classes or on their lunch break, to go outside and get some fresh air and take off the mask and walk around. It's a nice break and from your mask, and also just for the day to get some fresh air.
Great, thank you. We do have another question in the Q&A box. Thank you, attendees. The attendee asks, the hand dryers have been off in the faculty bathroom on the 4th floor of the C building since the pandemic. Is there a plan to turn these back on?
We certainly could look to turn these back on. There's other issues with hand dryers as well, but we could certainly look to turn these back on. We're turning drinking fountains back on. I think we can look to actually turn hand dryers back on as well.
Thank you, Zach. We have another question. It's a follow-up to the HEPA filter question. The person asks, can someone request a HEPA filter anyway? If so, how do they?
Yeah, I wasn't sure if Zach was going to answer that, but I think based on his question, it's not something that you would really request. The HVAC system already speaks for itself. He's gone over that. There really is no need, and is not something that we would provide upon request in general.
My button clicking is not on point today. There is a question asking for basically a reminder about the upload to CUNY First. Do staff need to be fully vaccinated to upload to CUNY First, or could it be uploaded after the first dose? And if you wouldn't mind just reiterating your answers from before, that'd be great. Fabian or Christine?
You have to wait until you're 2 weeks out from your second dose. If you're trying to make a deadline, then you can communicate that you're just shy of the second dose, or you're a couple weeks off. You'd have to be in communication with whoever's enforcing the deadlines. But in general, to my knowledge, you have to wait till you're 2 weeks out from your second dose, unless it's a J&J. And Fabian, you have to wait 2 weeks out from the J&J?
Right, so if the system for staff and faculty work the same, employees works the same as students, you're actually able to upload 1 dose of your vaccine. It would not be, you wouldn't be able to submit it, but you'd be able to upload it and save it onto CUNY first. Once you're eligible for the second dose, you have that, you get the second dose, then you upload the second dose. And based on the information you type into CUNY first, after you receive that second dose, that same day you get that second dose or first dose for Johnson & Johnson, you can actually submit that, you can submit it. And as Christine mentioned, you can be approved pending 14 days after your second dose or first dose if you have Johnson & Johnson. So generally, yes, you can upload it. I think it might be the same thing for the employees, but would not be able to literally submit it until your second dose is received.
And so just to thank you for clarifying, Fabian. So you can actually enter it, but it's not going to be approved or valid until 2 weeks out. So for example, if you're relying on it to get out of the test pool, you're not going to be able to be removed from the test pool until you're 2 weeks out, because again, that's when you are considered fully vaccinated.
Thank you, Fabian and Christine. I know that somebody had asked someone that had asked a question in the chat box, and I think they meant to put it into the Q&A. They ask, are we going to have more clubs so students can be more focused in school?
Yeah, I love that question, and definitely, well, one thing is I'm hopeful that we will not have to wait 2 years to unmask. So let's hope that we will move quicker than that. I agree with you 100%. We need to, do more things on campus. Students need to engage more on campus, and it's really important for student life. It's important for the intellectual development of a student, and to keep you, engaged on campus. And, I think you mentioned staying out of trouble. So the good news is, yes, we are heading in that direction. We're still waiting on a little bit more guidance. So just, bear with us and be patient, but you're starting to see a little bit more activity on campus. And as things continue to get better, which as Zach mentioned, things are getting much better. There'll be more opportunities for that engagement. Not the Zoom box engagement, but real, engagement. So yes, let's be optimistic. And I agree with you 100% that we should be doing more activities with the clubs. Once we get the green light to do so, we will be doing that, and you'll be getting that information. But I would strongly encourage all students to find out what clubs are active, get involved, even if it's virtual. And really getting, be engaged as much as you can on with respect to campus activities.
To talk a little bit about masking, and yes, let's hope it's not 2 years from now. Again, outside of Hostos, there's a lot of mask mandates that are kind of being relaxed, gone away. There's, businesses have more of an option to mandate masks or not. I think I saw this morning on the news, Apple stores, you don't have to wear masks in Apple stores, thank goodness, if you have an Apple phone like I do. And, something I also kind of want people to think about is that, we're moving rather quickly into a phase where some people will wear masks and some people will not, okay? Again, I think that it's important to remember that there's a layer of protection that you have if you're fully vaccinated. If you're fully vaccinated and boosted as well, you have a layer of protection. And so people are going to be able to make some of their own decisions in terms of, what are the control measures you want to take to protect yourself. I am a proponent of masks, as I think everybody knows, because I continue to push it strongly, personally and professionally. One thing I would also say is that don't throw out the masks so fast. I am not worried about a more dangerous variant. I am not worried about our future so much, but I think it's worth kind of mentioning that, which I've mentioned before, COVID will be with us forever. As long as humans roam the earth, COVID will be part of the list of risks that we have to face when we walk out the door and go about our business. I'm not sure, but I may personally mask up in the winter months because I suspect that there will be more respiratory diseases in general. They will spread more quickly in our great city of New York. Again, I mentioned about our density in New York City, but it might be a practice that is very common in many Asian countries, and I think it would be wise to adopt here in New York City. So there's a little food for thought. Again, I'm talking about the future. I'm making predictions, so don't hold me to them, but it's something to consider. And again, it's a pretty easy way to protect yourself too, ultimately.
Thank you, Zach. Can you just stay on and answer or reiterate a response you made earlier regarding the drinking fountains? An attendee asked, when will the drinking fountains work again? The bathroom water is warm.
Bathroom water is warm. Okay, so again, I'm working with facilities to get all of the drinking fountains open, operational, flushed, and ready for everyone to consume. I can't give you a specific date on that. However, I will tell you that I believe they're going to move pretty quickly on that. I would say by early next week, the vast majority of drinking fountains will be open, ready for use, for folks to use at your leisure. Again, remember, we want to reduce plastic waste. We have some new rules coming out on that. So we do have bottle fillers. I encourage you to bring your own bottles from home. I think you've noticed I drink from my own bottle here. No need to consistently buy plastic bottles. There's, I believe, only 12 that exist on campus in terms of bottle filling stations at drinking fountains. If we can do more, we want to do that. But again, I would say roughly by early next week, the majority of drinking fountains should be open, flushed, and ready for everyone to enjoy.
Thank you, Zach. We do have another question. I don't know if you may have the answer to, but an attendee asks, when will the Hostos garden be open? It would be nice to sit there.
I do not have a fine answer on that, unfortunately. It's related also to construction activities in the garden that are ongoing. And so I would be remiss to even predict when that might be open. However, I do want to encourage everyone to use the beautiful park across the street that is a public park created by the private entity that created that recent luxury tower, of which Hostos will occupy the first 2 floors. I do not know when we're moving into that, but the park is open for everyone to use. It's lovely. Last summer, we did a welcome back barbecue, which was wonderful. And so a little bigger room to spread out than our garden. Again, apologies for that, but at the moment, it is a construction issue that folks cannot be in the garden.
Thank you, Zach. And thank you for that reminder about use of the beautiful park that's right across the street from us. And again, as a reminder to our attendees, if you have any questions, please feel free to put them into the Q&A box. And again, thank you for joining us all here today. It's wonderful to have so many people here.
I just want to kind of let everybody know that, as we are showing you, we're excited everyone's coming back. I do understand that some are anxious, concerned about coming back. I really hope that we've been able to answer your questions as best as we can in terms of reassuring you how seriously we've taken everything we possibly can do to keep everyone as safe as is possible. There's always an element of risk. We cannot eliminate risk 100%, okay? But again, I think considering the measures from CUNY Central, what we've taken from that, applied and put into action here at Hostos, we have created a safer environment here on campus than certainly your typical restaurant, your typical sports venue, your typical concert hall. If you're doing some of these things, if you're going out in the world, I would suggest that you are still under a mask mandate, still under a vaccine mandate here at Hostos, and you are better off coming here to campus. One other thing I would say is that, again, you know, this form of communication isn't perfect. No form is. I want to remind you that I am still open to having more intimate conversations with department leads and their teams. I've done this many times, but I think not enough. So again, if you want me to speak to your team and we can talk a little bit more about your specific office situation or concern, by all means, ask your supervisor to reach out to me. I'd be happy to come to a team meeting and address whatever questions you have if this format wasn't ideal from your perspective.
Yeah, just to add to how safe, it is on our campus besides our HVAC systems and, all the monitoring we do on campus. Last week I reported 99%, actually, I made a mistake. I said 99.99. I guess I was really optimistic. So 99% of our students are are vaccinated, which is really amazing. Really small percentages of our students have been approved for exemptions, and those students are tested weekly. I also want to thank our Human Resources Office, Christine Diaz, for the advocacy to really, push to have this vaccine unit on campus. That wasn't something that was, required, and she really advocated. And to keep this great service going. Thank you to our Senior Vice President as well. Just to have that convenience to be able to just get vaccinated and boosted on campus is really great, or right outside the campus is really great. The other thing is being able to be tested on campus is another really great benefit that we offer. I remember when things were a little rough with the Omicron numbers being so high, the lines just to get tested were ridiculous in the community, and just being a CUNY student or employee and having that benefit is a really big deal. So I think, all of us work really hard, including, students in getting vaccinated and getting tested and being safe. And I think, you all are adding to all the success that we're seeing in New York City with the numbers going down. So really happy to see that, and just continue to be safe. And if you are eligible for those boosters, we highly encourage you to get them.
Christine, did you have some words to say?
Yeah, I just wanted to say thank you for having me here today. And what Mr. Korenstein and Mr. Wander said is just spot on. And yeah, just in terms of the testing, we are very fortunate, and we get those results back usually within 24 hours, which is faster than most places. We have all these supports in place that just help us transition through this pandemic. And, hopefully we're getting towards the end of this, and we're ready to start doing more, again, with our friends, families, colleagues here on campus, off campus, vacationing. I know we're in a different place with reasonable safety precautions in place. And I wanted to thank, we are so fortunate to have an incredible team here. I mean, you don't get a Zack Korenstein everywhere. We're very fortunate to have his experience and background here at our college. He is extremely patient and understanding and willing and able to address all of your concerns. And Nurse Vasquez has been incredible working very this pandemic to make sure that everyone's taken care of, no matter what time of day. And HR is certainly here to help all the staff as well with any questions and concerns, and to help with the transition back as much as possible. So thank you again.
Thank you all. We're now closing upon the hour. I'd like to take this opportunity to again thank Fabian, Zack, and Christine for their time and for the valuable information they provided today. Thank you to all the attendees who have come and posted their questions, and I hope we were able to provide some peace of mind for you. Should you have further questions, please feel free to send them to the covid19@hostos.cuny.edu email address. We'd be more than happy to respond to you via that email. So again, thank you all. Have a wonderful day. And what can I say? Thank you. Have a wonderful day. Bye-bye.
Take care.